Hello, Kim. Can you hear me?
Hi, yes, I can hear and see you.
Great. Give me 1 second. Dr. Fair will be in a minute.
Thank you. Hi there, Supervisor Mitchell. Good to see you.
Good to see you. Thanks for having me.
Right, we're getting everything set up. We'll begin in just a few minutes. Thank you to everyone who's joined us so far. Hi there, Dr. Frere. We just need a minute or two to get the slides up and ready to go. My apologies.
Okay. No, everything was a little late today, so no worries.
All right, then I should be ready to go. Let's go ahead and get this started. Good afternoon, everyone. Thank you so much for joining the Los Angeles County Department of Public Health today, January 6, 2022, for a media briefing. Today, we have the Director of Public Health, Dr. Barbara Frere, and Los Angeles Board of Supervisors Chair, Supervisor Holly J. Mitchell, presenting. Both the Supervisor and Dr. Frere will take your questions after the briefing. Remember, to ask a question, please use the hand icon, or you may chat me, the host. Supervisor Mitchell, are you ready to kick us off?
I am, and thank you very much, and Happy New Year. Wanted to, again, as always, thanks LA County Department of Public Health for hosting this press event and for allowing me to participate. Let me start by just saying, I think from my perspective, the obvious, how important our press partners are to us in our effort to communicate accurate, timely information. And to that point, I think it's really important that we all acknowledge the fact that messages are changing daily, from CDC making one declarative statement and a couple days later providing clarification, to the State Department of Public Health, and of course to Dr. Ferrer. And so I think what's really important is that we encourage the general public to keep up and to not get stuck with, it's changing every day. Yes, it is. And so it's really going to be important, again, that our media partners continue to update, acknowledge that it may be a new policy from what you've reported previously, and encourage the general public to follow you all to keep current on the changing information, health orders, and trends with the current strain of the virus. Secondly, I'm really hoping that you all, as our partners in this and our partners in communication, will help us with the strain our emergency rooms are experiencing, particularly to encourage people not to go to an ER to test. I appreciate that your experience may differ depending upon where you are in the county in terms of your ability to access either a home test kit or to go to a testing site. But the ER, given the what they are grappling with currently, the ER is not the place to go to test. I think that's a very important message that we need to get out to the general public as quickly as possible, as well as communicate to them places and to help clarify or perhaps manage expectations about how long it might take, the fact that most places require appointments ahead of time, even though my office and my colleagues are working very hard to make test sites available that don't require an appointment. But I think the critical message is let's not clog our ER with people who are simply going there for a test. Let's keep the ER and our urgent care facilities available for people who need treatment as a result of having already tested COVID positive. With that, I know Dr. Ferrer, you've got lots of important information and data to share, and so I will kick it over to you. Thank you for the opportunity, as always.
Thank you so much, Supervisor Mitchell. Your leadership, your wise counsel, especially needed during these very challenging days of another winter surge. And I appreciate your pointing out that unfortunately, with this virus, lots changes. And as things change, we also have to have some flexibility to change what we all are going to do to try to keep slowing down transmission. That's been the name of the game. Really almost for 2 years now. And I appreciate everyone's efforts and hanging in there while we're faced with additional challenges with this new winter surge. I will provide updates on local metrics by vaccination and booster status. I have some more detailed information looking at hospitalizations and illness severity that I'll be able to share today, as well as talking a little bit about what we know about the spread of the Omicron variant here in LA County. As always, I'll give updated numbers on our progress with vaccinations, and I'll close with some updates on strategies for mitigating transmission during this surge. But we could start with the first slide. These are the real-time numbers we've been seeing over the past week in LA County. As you can see, daily cases have risen steeply from about 27,000 cases a day on New Year's Eve to now today, 37,215 new cases. Meanwhile, reported daily deaths, which dipped over the weekend due to the lag in weekend reporting, have now increased from about 12 on December 31st to 30 being reported today. Also seeing consistent increases in hospitalizations. We're at 2,661 daily hospitalizations of confirmed COVID cases. This is twice as many as we saw a week ago. Test positivity has really remained essentially steady, but very high at 22 to 23% of everyone tested, getting tested as testing positive. While these numbers will change as we receive new case, hospitalization, and death reports over the coming weeks, I do think that sharing them offers a context as to the urgency for all of us to take whatever additional steps are possible to address this surge in new infections. We can go to the next slide. I do want to share, can you go to the next slide, perhaps? Okay, no, go back, sorry. I'm unfortunately, it's okay, go to the next slide, yeah. I do want to just talk for a little bit about what we're seeing all across the country with daily cases so that we understand, this is a surge that's being experienced widely. And that, calculations also differ, but pretty much everywhere we have really high numbers of daily cases per 100,000 people, with obviously looking at New York City with the highest daily case rate. But I think for all of us, we're going to continue to see for at least the next 2 weeks, our case numbers go higher and our rates obviously go higher as well. We can go on to the next slide. This slide does show us cases, hospitalizations, and deaths between July 1st of last year and January 5th of this year, 2022. The cases in green and the deaths in blue are presented here by the date they were reported, and hospitalizations, which are in orange, are presented by the date of admission. As you can see, the cases have really surged there by 90% just in the past week. This is pretty much a straight line up. And hospital admissions also 121% increase this past week. Next slide. But the trend line on this slide actually is doing something a little bit different for us. It shows the daily average COVID hospitalization census countywide in orange over a period spanning from April 2020 through January 4th of 2022. And above it, we're also showing the total countywide hospital census during the same time interval. The steep rise in the orange line near the end of this graph shows the increase in hospitalizations that we just talked about over the past week, where we're now over 2,000 cases. But nevertheless, it's important to note that unlike last winter surge, when overall hospital census increased pretty significantly, and we also saw that over the summer surge, now with the current surge, the hospital census has remained much more stable. Now, this can change. Obviously, hospitalizations are a lagging indicator, and as cases go up shortly afterwards, we start seeing the increases in hospitalizations. But I do want to note that we haven't seen the same rise we saw at the beginning of the winter surge last year with our surge in hospitalizations this time. Early in the surge, though. Next slide. But although, again, the hospitalizations have been rising rapidly, the percent of patients with COVID in the ICU has increased only slightly, from 5% to 7%. For comparison, at the peak of our winter surge, more than half of the ICU beds countywide were occupied by people infected with COVID. So I think the trajectory we're seeing on this trend line is very different from what we saw really either with the summer surge, where it went up more rapidly, and certainly in last year's winter surge. Next slide. And as we noted earlier in the week, many of the positive COVID patients that are hospitalized are seeking hospital care for a non-COVID related health issue. They may be hospitalized for a hip replacement, cardiac surgery, or cancer care. But because all patients are tested for COVID on admission, we reflect all of those patients in the COVID positive count when we look at hospitalized cases for COVID. But there's another way that we're able to look at this, which is we're actually able to look at who's in the hospital related to COVID illness. And that's what we tried to do on this slide. So in early November, pre-Omicron, you can see about 75% of hospitalized patients who were testing positive for COVID were hospitalized for medical problems that were related to their COVID diagnosis, leaving about a quarter of the hospitalized patients with a positive COVID test and having their COVID diagnosis really incidental to their hospitalization. Now, however, in December, late December, we're estimating that the percent of people hospitalized for COVID illness has declined to about 45%, meaning that more than half of the COVID positive hospitalized patients are in the hospital for non-COVID related illness and would likely have been hospitalized regardless of their COVID status. And I think this is important for us to continue to track. It's really makes a lot of sense when you've got a lot of community transmission. You're going to have more people testing positive who are asymptomatic for COVID illness, but in this case, getting hospitalized for something else. And would be in the hospital regardless of the fact that they're COVID positive. And it's encouraging to see that there are fewer people hospitalized for COVID illness during this surge, especially compared with prior surges. But I do want to note that even if folks aren't in there getting care for COVID-related illness, COVID-positive patients represent a substantial strain on the healthcare system. People who test positive for COVID require resource-intensive transmission-based precautions, including isolation rooms, cohorted staff, and personal protective equipment, all of which add a particularly high burden when so many of our hospitals are, as we've noted earlier, short on staff. The next slide. Findings suggestive of less severe COVID variants, are really consistent with what we're seeing in the rising proportion of Omicron amongst LA County cases linked to our sequencing results. Last week, Omicron comprised more than 85% of the sequence cases, while Delta comprised the rest. This dramatic decrease in the overall number of Delta cases over a really short period of time suggests that Omicron is crowding out Delta here in LA County, and these results are similar to what's seen in other places across the country. Next slide. As always, to better understand how our vaccines are holding up against both Delta and Omicron, we look at the data we have on case rates by 3 categories of vaccination status: unvaccinated, fully vaccinated, but without an additional booster dose, and fully vaccinated with the 3rd additional or booster dose. Cases, as you can see, have continued to increase rapidly among all of our groups. For those unvaccinated, that's represented by the top dotted line. In the week ending December 25th, there were 991 cases per 100,000 unvaccinated people. Cases also among people who are fully vaccinated but didn't yet receive their boosters, that's represented by that dashed line, are lower, but they're still trending upward rapidly, reaching a rate of 588 new cases per 100,000 people each for the week that ended December 25th. And meanwhile, the case rate among people fully vaccinated who also received their additional or booster dose is also going up, but it's the lowest rate of all at 254 cases per 100,000 individuals. So although the rate of rise, really, you can't get away from seeing this across all 3 categories is steep, it is still much lower among those who are vaccinated and lower even more among those who are vaccinated and boosted than it's among those who have not been vaccinated at all. And this is a stark reminder that vaccinations still provide protection against COVID transmission. Next slide. To better understand the protective power, we do monitor these rate ratios, which compare rates in unvaccinated people to rates in fully vaccinated people. The higher the rate ratio, the more protective the vaccine. We're also able to look at how these ratios change when we compare unvaccinated people with those vaccinated but unboosted, or those vaccinated and boosted. So the column on the left compares unvaccinated people to fully vaccinated but unboosted people. Between the weeks that ended November 28th and December 25th, as Omicron began circulating more widely, fully vaccinated but unboosted people went from being almost 3.5 times less likely to get infected to 1.5 times less likely to get infected when compared to unvaccinated people. If you look at the column on the right, fully vaccinated and boosted people went from being 19 times less likely to get infected when compared to unvaccinated people to about 4 times less likely than unvaccinated people to become infected. So while the rate ratio decreased dramatically in both groups, protection still remains for those vaccinated, and people who have received boosters have considerably less risk of getting infected than everybody else. Next slide. When we look at the case rates rising on a trend line week to week, it's easy to feel that these rates are impersonal and they're just a set of numbers. But we can also look at how these rates have changed within our different race and ethnic groups across the county. And this really shows just how explosive the increases have been for everyone. The surge in cases has been particularly high among Black and Asian residents, who saw a 13-fold and 17-fold increase in their case rates between the 2-week periods, the first one ending November 25th and the second one ending December 30th. These increases have ranged approximately 8 to 9-fold in the Latinx and white residents. Next slide. As we switch from looking at who's getting infected to who's being hospitalized, we're mindful that there are significant differences in hospitalization rates between people based on their vaccination status. With additional hospitalizations, we're this week able to start looking at this metric on hospitalizations using those same 3 categories we use to look at case rates: unvaccinated, fully vaccinated without a 3rd additional or booster dose, and fully vaccinated with that 3rd dose. Note that because this 3rd category of boosted individuals contains only a week's worth of data, and there are so very few people in this category, this solid line is barely visible. It's barely visible. It's sort of we've circled it in red so you can see it more easily. But at the end of the day, hardly anybody who's fully vaxxed and boosted is hospitalized. Above the short line, the dashed line represents the hospitalization rate in fully vaccinated but unboosted folks. And it's really that solid line there. It's really the solid line. Sorry, it's not a dashed line. That solid line remains really low as well. And while it's rising slightly, the rate of hospitalization among those vaccinated but not yet boosted is still 6 times lower than the 25 hospitalizations per 100,000 unvaccinated people who are hospitalized, which is represented by this dotted line at the very top. So really, again, super clear that you get a lot of protection from being vaccinated against ending up in the hospital. And if you go to the next slide, we look at the hospitalization rate ratios over time to help us really quantify the protective nature of the vaccines. So we go to the next slide, please. So the column on the left, again, is comparing unvaccinated people with fully vaccinated but unboosted people. And here again, we went from those who were vaccinated but unboosted being 13 times less likely to 9 times less likely to be hospitalized than vaccinated people over the course of December as Omicron circulated more widely. And because we weren't able to do this calculation for those folks who were vaccinated and boosted until this week, but as you can see, the protections for those who are vaccinated and fully boosted is huge. They're 38 times less likely to be hospitalized than vaccinated people, than unvaccinated people, sorry. Next slide. We're grateful that for the time being, the death rates remain relatively low and stable. However, as always, our hearts go out to everyone who's lost a loved one because of COVID, and that's over 27,000 people. However, we do have some concern that as we see these rapid increases in cases and the increases in hospitalizations, we could soon begin to see some increases in deaths. And unfortunately, those deaths are far more likely to be among unvaccinated people who are currently 25 times more likely to die than people who are vaccinated. Next slide. And you can see this as well if you look at the rate ratios, which really haven't changed. Again, the protections for the vaccines, even with Omicron circulating more widely now, we haven't seen any changes in the extraordinary protection against this very worst outcome. However, again, a note of caution, it can take many weeks to see deaths rise after a surge in transmission. We're going to need to watch this data over the next few weeks. Next slide. We also continue to track outcomes among people who have been fully vaccinated, regardless of whether they receive those additional doses, to help us understand the impact of different outcomes for people who are vaccinated. As usual, the numbers of cases, hospitalization, and deaths among fully vaccinated people are visualized here to scale. The large green box represents the more than 6.4 million fully vaccinated residents in LA County. You can see our purple box has grown between last week and this week. The proportion of fully vaccinated people who have tested positive for COVID increased from 2%. That was that white dotted line we put on there to now 3% of all vaccinated people. While this is a large increase in cases, I do want to note that there's no accompanying increase in the proportions of those vaccinated that were hospitalized and died, which remains steady at 0.05% for hospitalizations and 0.01% for deaths among those who are fully vaccinated. Next slide. Given that vaccines remain the most powerful tool we have against the virus, and they're now available to everyone 5 and up, we do continue to track our progress in vaccination coverage across the entire county. As of January 2nd, 79% of LA County residents 5 and older received at least 1 dose, and 71% are fully vaccinated. 81% of teens 12 to 17 received at least one dose. And after nearly 8 weeks of vaccine eligibility, 24% of children 5 to 11 received their first dose. at least their first dose. While overall coverage is increasing slightly every week, there are almost 2 million eligible residents who have not yet received their first dose of the vaccine. Our data on boosters is also sobering. While more than 2.5 million LA County residents have received additional or booster doses, there are 2.9 million residents that are currently eligible for boosters who haven't come in for that additional dose. As cases and hospitalizations rise, we urgently need more people to get protected by the vaccines and by the boosters. Next slide. On this chart, you see the first doses administered each week represented in blue. The second doses are in yellow, and the additional or booster doses are in orange. Last week, we administered about 250,000 vaccinations, 43,000 first doses, 35,000 second doses, and about 168 additional or booster doses. The small decline that we've seen over these past 2 weeks, I think reflects the 2-week holiday season. We also had sites closed for the holidays. But we do think with folks returning back from their vacations and the news yesterday that the CDC endorsed the FDA's approval of Pfizer vaccine boosters for children as young as 12, we do hope to see an even greater increase in the number of people getting vaccinated and boosted in the upcoming weeks. Next slide. There are 3 priorities that are guiding our response during surge. Doing everything we can to protect medically vulnerable individuals, especially those residing at skilled nursing facilities and experiencing homelessness, ensuring that we protect our hospitals and the functions of our healthcare systems, and reducing opportunities for extensive spreading. These priorities dovetail with our strategies for protecting workers and reducing the numbers of infected people who spread to others at schools and businesses. With this in mind, we have made some changes to the health officer order that I'll go over. We can go to the next slide. In the updates to this order, which we posted yesterday, employers will be required to provide employees with upgraded masks. That's a well-fitting medical grade mask, surgical mask, that's surgical mask, an N95, a KN95 mask by January 17th for employees who work indoors with close contact with other workers or with the public. To align with the state health officer order, we're also lowering the mega event attendance thresholds to 500 attendees for indoor events and 5,000 attendees for outdoor events. At mega events, performance venues, movie theaters, and entertainment venues, operators need to take responsibility for messaging, signage, and compliance with our masking requirements. The only exception to masking requirements at these events are for those spectators or attendees who are actively eating or drinking. The health officer order also recommends that where possible, food and beverages be consumed in designated dining areas at these venues. These changes, they're also a change to the order that prohibits food and drink at gaming tables and card rooms where masks must be worn at all times when indoors, except when actively eating or drinking in a designated dining area. These are changes, again, to help us particularly protect workers, many of whom will continue to provide essential services to the rest of us, even though we have really extensive spreading of the virus. Next slide. With cases surging, sorry. Can you go back? Nope. Yeah, quarantine. Thank you. And I would like to go to the quarantine and isolation slide. Can you go back? Thanks. With cases surging, it's sensible to follow the science and do everything we can to reduce risk and prevent severe illness and deaths among our residents. A consistent strategy for reducing transmission is having infected people isolate away from others and having their close contacts quarantined. Our guidance for quarantine and isolation remains the same as it was last week. People who test positive for COVID-19 must isolate, which means staying home a minimum of 5 days. Isolation can only end after day 5 if there's a negative test on day 5 and the person has no symptoms or no fever and their symptoms are resolving after day 5. However, as a reminder, if you test positive on day 5, if you have a fever, if your symptoms are not resolving, or you cannot get tested, people need to continue to isolate until they either have a negative test or 10 days have passed and they're fever-free with resolving symptoms. Please do not infect others while you are infectious. As a reminder, everyone who tested positive is required to wear a high-grade mask when indoors and outdoors if around others for 10 days after testing positive. Close contacts are people who have been exposed to a positive COVID-19 case. Those close contacts who are up to date on their vaccines, and that means they're fully vaccinated and not yet eligible for a booster dose, or they're vaccinated and boosted, and they have no symptoms. All those folks, they're exempt from quarantine. However, individuals who are exempt from quarantine need to monitor their health for 10 days. And if it's possible, you should get tested, hopefully as soon after as you know that you were a close contact to make sure that you're not infected. Everyone who's a close contact should wear a high-grade mask for 10 days, regardless of symptoms. And if there are symptoms, you need to stay home and retest. If any test is positive, then you need to follow the isolation recommendations because you are infected with COVID. Those close contacts who have symptoms, or they're unvaccinated, or they're unboosted despite being booster eligible, those folks must quarantine. This means staying at home away from others for a minimum of 5 days. If you have no symptoms and a test taken on day 5 is negative, quarantine can end after day 5. However, if the day 5 test is positive, or you can't do a test, or you have any symptoms, you need to stay home for the rest of the quarantine period up to day 10. It's also required that you wear a high-grade mask indoors and outdoors when around others for 10 days, regardless of whether you have symptoms or you're vaccinated or you're out, you've been able to shorten your quarantine period. As in the past, we ask that anyone who tests positive notify their close contacts, any of their close contacts they had in the past 48 hours. You're going to go back 48 hours from when you tested positive or when you had your symptoms, so that those folks know that they need to quarantine if appropriate and take precautions. For those who test positive and have questions, or you need help notifying your close contacts, or you need help isolating away from others, please contact our call center at 833-540-0473, 7 days a week. We're open between 8 a.m. and 8:30 p.m. Next slide. I do want to close by just noting the changes in the booster recommendations. Earlier this week, the FDA approved Pfizer boosters for use in children 12 years of age and older, and CDC yesterday endorsed this expansion of eligibility and recommended that boosters be administered as soon as 5 months after completing the primary COVID vaccine series for teens. This slide summarizes the current booster recommendations. Everyone 12 and older who received a Pfizer vaccine is now eligible to receive a booster at least 5 months after completing the primary series. Adults 18 and over who received a Moderna vaccine can receive a booster at least 6 months after completing their primary vaccination series, while those who received a Johnson & Johnson vaccine can receive their boosters at least 12 months after receiving their Johnson & Johnson vaccine. A Pfizer or Moderna booster is preferred regardless of your primary series for anybody who's 18 and older. Teens 12 to 17 can only get a Pfizer booster. Given the effectiveness of boosters in preventing transmission and severe illness, we do anticipate that these changes will increase our ability to reduce the worst outcomes associated with surge. However, with thousands of newly infected people each day, we recognize how challenging these times are. Many services are strained as workers are ill or quarantined. Families are facing major disruptions trying to care for those infected or quarantining. And for so many, It's really hard right now to get tested and to sort through the changing guidance. I know it's going to take a lot of effort to get us through these hardships, and we'll need to do our very best to stay safe. So please stay home if you're sick. Don't call 911 or go to an emergency room unless you have a true medical emergency. Comply with isolation and quarantine rules to avoid spreading Omicron to others, and reduce your own risk of transmitting or getting infected by curtailing non-essential activities where you're going to be with large numbers of people, particularly if they're going to be indoors. I'm now happy to take your questions along with Supervisor Mitchell.
Thank you so much. As a reminder, if you have a question, please use the hand icon, or you may chat me, the host. I'm happy to read your question out loud. Our first question is going to come from Ron Lynn with the LA Times. Ron, you're unmuted.
Hi, Supervisor and Dr. Ferrer. Thanks so much for taking our questions. Our questions today are on the Grammys, the Super Bowl, testing in schools and hospitals. First, with regards to the Grammys and the Super Bowl, did the Department of Public Health suggest that the Grammys be postponed in light of the surge? And with the Super Bowl, are you concerned it could turn into a super spreader event and that there could be problems enforcing a mask or vaccination mandate? Or do you think SoFi Stadium can hold the Super Bowl safely? Second, under what conditions would it make sense for a school or district to push the start of school back a few days or a week or two, or go online temporarily until Omicron subsides or until more testing can be done given the positivity rate and staffing issues? How many tests are needed compared to what is available? And finally, regarding hospitals, at the top of your remarks, you mentioned some optimistic trends, but we've also heard that 911 response times are worsening, ambulances are waiting longer to drop off patients, and Dr. Mark Galley pointed out that statewide, he's concerned that the overall number of Californians hospitalized for all reasons is high. How would you convey to a regular person how hospitals are faring now, and how would you compare what's going on compared to last winter surge, the summer Delta surge, and and a bad pre-pandemic flu year? Are we actually still worse than we would be in a bad flu year? Thanks so much.
Yeah, thanks. Let me start from your last question, Ron, because I think it's a really important question. So if you have a ton of transmission like we have now, it affects everybody's workforce. So short staff, everybody's short staffed. Just about every business is facing staffing issues, and certainly hospitals and healthcare providers are facing staffing issues. So that's the real difference between, what we have now and what we had, for example, when we had the Delta surge, where we actually had lots of patients who needed hospital care, but we didn't have this sort of raging rate of infection that was really making it super hard for there to be enough staff to care for people who needed care in the healthcare system. So that's why we're going to have to really pay a lot of attention to the stress that our healthcare system is under, because part of it is just due to the impact of high rates of transmission on staff, and the other part is due when there are so many thousands and thousands of people infected, even small numbers of people that need care because they have COVID illness could in fact have an impact because there's going to be many more of them than we had, particularly during the Delta surge, over the last summer. I think for all of us, we need to take care of ourselves. We need to not go to the emergency rooms, not use 911 because we're looking for a test and we're frustrated that we can't get one. Those emergency services are being strained by what I already said, staffing shortages and the demand from people who need that care, need those services. So other people who don't need the emergency services should not be taxing that system. In terms of, should schools delay their start, we work really closely with all of the district schools, and we support our private and parochial schools as well. We think that there is testing capacity at the schools now to continue with that routine testing. We know there's anxiety because all of the schools have not received those test kits in time to be able to test all students before schools open. But we do want to note that many schools have test kits and many schools have resumed that routine testing. And I think with the additional safety measures that are in place, really, again, requiring that people keep those masks on when they're indoors, as always, and outdoors when it's crowded, that will help, again, prevent transmission at the schools. But we work, these are district decisions, particularly around the issue with staffing shortages. I mean, obviously, if you don't have enough staff to manage your students who are attending your school, then it won't be safe for students to attend. So I think, again, as with the hospitals and the healthcare system, staffing shortage issues are really going to force districts to make individualized decisions based on who's available to help support students with their in-person learning. I think in terms of your first question about the Grammys and the Super Bowl, I want to acknowledge the Grammys producers. As always, production companies do talk to us about what the situation is here in LA County, and we've had really productive relationships with all of the large productions that have been taking place here in LA County. The Grammys made their own decision to go ahead and postpone. I think it's a recognition of their, sort of the safety of the talent that needs to participate fully in that show as well. And that, when you're having the highest rates of community transmission, it's probably a very prudent decision for an indoor event in particular to continue to go ahead with a postponement, which is what the Grammys did. In terms of the Super Bowl, I want to thank SoFi Stadium. We've had an amazingly successful partnership with SoFi Stadium. I think they're one of the leaders around the country in providing safety solutions during a pandemic. It will be challenging if the surge continues into February, but I do think we're working closely with both the NFL and SoFi Stadium to have a wonderful Super Bowl here with the appropriate safety precautions that will keep fans safe and our community safe. So we continue to work very closely with both SoFi and the NFL, and I feel really confident that this event will happen here in LA. There's no indication that it won't, and that we'll work really closely to enhance safety if, again, we're still in the middle of a horrific surge. My hope is that, by the time we get to February, we're on the downside of seeing this massive amount of community transmission.
Dr. Ferrer, if I might add, I saw the press coverage in a couple of different periodicals yesterday about, should the Super Bowl move to Texas or move some other place? Well, this is a international pandemic. I'm not sure why it would make more sense to have it in Texas, to move it to Texas, than to have it here at SoFi, quite frankly. So I'm glad to hear you acknowledge the role that SoFi leadership has played throughout the pandemic. I think one of the first, I saw you there, Dr. Ferrer, was several months ago, feels like a lifetime ago. One of the first big gatherings I went to was at SoFi Stadium. And so I felt very confident. I just want to remind us all that a policy is a policy unless people choose to adhere to it. And so my plea is to all of those locals and those who will travel to Inglewood, to SoFi Stadium for the Super Bowl, that you follow our health orders and that you mask. I would encourage people to get vaccinated and boosted before they come. We shouldn't assume that individual decisions don't have the greatest impact in the spread of this virus. And so, as you said, those entities have worked very hard to create policies and infrastructure to protect us. It's up to the individual to choose to stay masked through the entire game to keep themselves safe and everyone else.
Yeah, thank you so much, Supervisor Mitchell. I think what you said is probably the most important set of rules that we all need to follow for the next few weeks. that's how we're going to get through this very challenging time. So we could take the next question.
Our next question comes from Christopher Reber from AP. Christopher, you're unmuted.
Hey, thanks. I've talked to several residents who have ordered home tests by mail from the county, a service that you provide, and after a week, several of them haven't received them. And as you know, lines at testing sites are incredibly long, and results can take several days to get. How bad is the testing problem right now? You said earlier how important it is to be tested, but a lot of people are having trouble. What more can the county do?
Yeah, thanks. I think that's a really important question. And I think it's a source of most of the frustration right now is, people are doing the right thing. They want to get tested, and it's gotten more complicated to get tested. So the in-home, test kit, that was mailed, that was, in the past able to be mailed to folks, that program is paused because they were running into some serious challenges with the vendor around, just like you noted, getting those deliveries on time to people's homes. My understanding is the Department of Health Services that runs that program is rapidly switching to making those in-home test kits available at the departments, at the county's testing sites. And you can go on our website to get a list of those testing sites. There are dozens of them. And that folks can either drive up to those, go to those sites and wait to get a test right there, or they can go ahead and pick up one of those kits. And then again, as it was before, it's free, and you can go ahead and mail that directly to the lab, and you'll get your results in a couple of days. So we're still distributing those in-home testing kits, but you'll need to pick them up at one of the county's sites. And my understanding is that should be available tomorrow, but I think you can go to the testing website to get both the locations where that's happening and also information to just verify that those kits will be there by tomorrow. I'm pretty sure they are. I also want to note that the Department of Health Services is rapidly increasing the number of testing sites, using sort of mobile teams to be able to pop up some sites in communities where it's been really, really difficult for people to get access. And these are communities that have high case rates. So again, trying to take what is, a relatively stressed resource and put it in places where we think people have the poorest access to tests. And again, I want to note that at our testing sites, we really encourage people who have symptoms to make sure that they go ahead, try to get a test. But if you can't get that test, please don't decide because you didn't get tested, you don't have COVID and you don't have to stay home. If you've got symptoms, we do ask, while we're trying to increase testing capacity and make it much easier for everyone who needs a test to get a test, you please stay home while you're symptomatic. And hopefully, over the next few days, you're going to see better access to testing in the county. You can take the next question.
All right, our next question comes from Marla Tejas from Fox 11. Marla, you're unmuted.
Okay, I just thank you, Dr. Ferrer and Supervisor Mitchell. I just do have a follow-up just to be completely clear here. I know some people in the Fox 11 newsroom did actually go onto your website after you announced that last week to order a test, and I confirmed with them that they still haven't received it. So that isn't in the works then anymore. And I do have another question, but I just want to clarify that. So they should then follow up and figure out where to go pick it up.
So, it's a great question, Marla, and because we're not administering that program, I don't have the answer for people who already submitted a request to get a home kit.
Okay.
Let us check in with DHS and we'll contact you directly with that response. Because you're right. I mean, what it was, there was people put in their requests and then they just didn't get it. But my sense is they're going to try to process through those requests, but I want to verify that. I think they did is they put a pause on taking any new requests. But again, I want to note that if you're waiting, for a week now to get a home test kit and you have symptoms, you might want to go online and try to find another place to test.
Okay.
Because it would be important for you not to continue to wait long while you have your symptoms. For other people who were just testing, more out of convenience or because, they had recently traveled or they wanted to know their status before they participated in activity, you may have more flexibility to wait. But I think for people who have symptoms, we want to make sure that they're getting access to tests as quickly as possible.
Okay.
We recommend that they continue to wait, but we'll call you. We'll have someone from DHS follow up with you on that, Marla.
Okay. Thank you. Am I still on? Can you still hear me?
Yes, you are.
Okay. Yesterday I was on the call with Dr. Mark Alley and about the extension of the indoor mask mandate statewide. And I asked about, is there a target number in terms of, I know hospitalizations is the metric that the state's really looking at to be able to, move out of that mandate phase for indoor masking statewide. I know that LA County, we have ours up and there is no end date in sight. So I got you to smile. So I think that's a good thing.
Well,
is there
an end date.
basically what I understand that Omicron is surging. The
No.
good news is, as you know, and you tell us, is less severe. What will it take for us to get, sort of out of this?
Yeah, it's a great question. And I know we don't have a date, but what we did do is we laid out the criteria by which we will be removing that mask mandate. And it did require that community transmission moved by the CDC definition back to moderate or low transmission. So, we're very far away from that. It also, I believe it also looked at, how well our, what was happening with our hospital care system. But we have that criteria, and that is the criteria that we'll be able to use so that we know we can get out. The third criteria was obviously we can't have a variant of concern that's circulating that threatens vaccine protections. So again, right now the data is pretty solid that these vaccine protections against what we call severe illness and death are holding. And that is the good news. But again, we laid out criteria because we wanted it to be a sensible time for us to lift that mask mandate. We wanted everyone to understand what it would take, but it does require reducing transmission and again, not having an unknown variant of concern circulating that threatens our ability to be protected by vaccines. I think the second criteria for us was that we reached 80% of the population was fully vaccinated, eligible population. Actually, it was 12 and older was fully vaccinated, and we're close to getting there. So, I think the big issues for us are reducing transmission and making sure that our vaccines continue to protect us from serious illness and the worst outcome from COVID, passing away.
All right, our next question comes from Ellie Yu from KPCC. Ellie, you're unmuted.
Hi, Director Ferrer. Could you sort of help explain why we've seen such a big increase in the rates among Black and Asian residents, particularly in the last 2 weeks? And then sort of following up on the at-home testing program, are we seeing sort of a lag in testing because we're seeing sort of staffing shortages at labs as well as people are calling out sick because of COVID? I mean, it sounds like staffing shortages are everywhere nowadays. And what should individuals do if, their employers don't give them time off to isolate or quarantine? Thank you.
Oh, those are a lot. So let me start with the last, what should employees do who aren't able to isolate or aren't easily able to isolate or quarantine because it's going to create a lot of financial hardship or they're going to potentially lose their jobs. One thing is, please let us know. We have a call-in number with our environmental health folks. And you can report anonymously. So we do ask that line is 888-700, I think 9995. We ask that people call in with complaints about employers who really aren't adhering to the guidance. People who are given isolation orders and quarantine orders need to obey those orders. Those are, mandates, and they are something that keeps the workplace safe as well. So we're always happy to talk to employers, and people can report to us anonymously so that there's no risk to them for their jobs. And I do encourage people to let us know if there are employers that are making that a really impossible situation. It's hard to imagine that employers wouldn't respect the fact that our employees that are infected and our employees that are close contacts need to not spread to others at work sites and in our community. So I do hope folks report to us. And I would just urge folks to make the good decision and not infect others by going out to a work site when you have tested positive. It really ends up potentially creating both a longer surge, but more importantly, you can infect somebody who can have a very dire consequence. So I do ask, let us know, let us work with your employer to clarify what our expectations are. And then if you have issues because you don't have a place to isolate effectively or you can't quarantine, again, I gave a number that people can call because we can help you. We also help people if they are quarantining and isolating and having problems getting basic needs met. So again, that number has people who are there to help you be successful around quarantining and isolating. And, I'm really sorry to hear that there are any employers in LA County that don't understand the urgency of making it easy for their employees. I've already said, I think we need paid sick time. This shouldn't be an issue that comes up over and over again. Every time, we have a conversation during a surge about how important it is for people to not choose between their jobs and their health and the health of our community. So, my hope is that moves forward as well. And I know Supervisor Mitchell could also, address this issue about employers.
I couldn't agree with you more, Dr. Ferrer. This is a public health crisis, and we certainly don't want to be in a position, and I know you've spoken very clearly about that, where we even entertain anything close to the shutdown that we experienced almost 2 years ago now. And in order to do that, employers and all of us have to be partners and create safe workspaces for both you customers you serve and the employees that keep your businesses running. So I agree and hope that employers get it and do the right thing. And in the event that they don't, the people take advantage of the call-in number that you referenced. The other piece I would add is I appreciate your criteria approach versus setting an arbitrary date. I think the criteria approach lets us all track our collective progress toward meeting that goal, so people have a sense of ownership as opposed to just kind of waiting for a date to appear on the calendar. If we all do what we need to do, we will meet those goals that you've set out for us, and then we know that we can live without the mask mandate. So thank you for creating that strategy because I think it's the most appropriate.
Thank you, Supervisor. I think we only have time for one more quick question today.
All right, we have one last question from Howard Bloom with the LA Times. Howard, go ahead.
Hi, thanks for taking my question, squeezing in. I hope this is not too long of a question. In a recent letter to school officials, you cited 3,000 hospitalizations as a threshold for triggering more aggressive school safety protocols. We were at 2,600 today. So to what extent is that still the plan, and what additional protocols would be triggered? Thank you.
Yeah, thanks, Howard. I'm trying to, there were only, you're absolutely right. It's a threshold. We need to be there consecutively. And we do note that we're likely to meet that threshold. And it really was to increase testing if there was capacity for there to be more testing. And it gives us at the health department some flexibility around modified quarantine. And rules during outbreaks, but it wasn't, there were no big shifts there except to try to put in place more testing. Again, more testing is only possible or feasible if we're able to secure those additional resources. So I don't think there were there were any big changes there, except to acknowledge that, particularly if we have a lot more outbreaks at our schools, we'll need to, again, have some flexibility on managing the modifications we've made for quarantine that are just available at our schools right now. So thanks.
All right. Thank you so much, everyone, for joining us today. As a reminder, if you have additional questions, you can send those to us at our media inbox. It's media@ph.lacounty.gov. Dr. Freer, did you have any additional comments? Supervisor Mitchell?
I'll let Supervisor Mitchell close us.
Thank you, Dr. Ferrer. I'm not sure, I got a little distracted. If you responded to the, may have been the Fox 11 reporter who asked about the African American and Asian numbers. I would just say for the second supervisorial district, our increase in test positivity really mirrors those segments of our communities that aren't vaccinated at the same rate. And so the African American population has a poor vaccination rate than some of our some other ethnic groups. And so it should be no surprise, quite frankly, that that's the community that is testing at a higher rate. Hence my insistence, my constant vigilant encouragement for people to be vaccinated, as we are learning that is one of the tools we have in our toolbox this time that we didn't the last 2 years. And so getting vaccinated certainly will bring our numbers down in terms of hospitalization, severity of illness, and ultimately deaths. So for me, it's a clear parallel about to again justify the need for vaccination.
Thank you, everyone. We'll see you
Thank
next
you,
week.
everyone. Thanks, everyone. We will see you next week, as Dr. Ferrer said. Spanish remarks are coming up in just a few minutes. Monica, can you hear me?
Yes, I can hear you.
Let me get your slides pulled up. Okay, if you would like to go ahead and get started, thank you for everyone who is joining us for the Spanish portion of today's briefing. Today is January 6th, 2022. We have Monica presenting. Monica, when you are ready.
Thank you so much, Kim. Esta tarde proporcionaremos una actualización de nuestras métricas locales por vacunación y estado de la administración del refuerzo y alguna información detallada sobre hospitalizaciones y la gravedad de la enfermedad, así como lo que sabemos sobre la propagación de la variante Omicron. También proporcionaremos datos sobre nuestro progreso con la vacunación y cerraremos con actualizaciones de las estrategias para mitigar el contagio durante el actual pico de la pandemia. First slide, please. Estos son los números en tiempo real que hemos estado viendo durante la última semana en el condado de Los Ángeles. Como puede ver, los casos diarios han aumentado considerablemente de aproximadamente 27,000 por día en la víspera de Año Nuevo a 37,215 casos nuevos informados hoy. Mientras tanto, las muertes diarias reportadas que descendieron durante el fin de semana se han multiplicado por 2,5 de 12 al 31 de diciembre a 30 hoy. Hoy estamos viendo 2,661 hospitalizaciones diarias de casos confirmados, el doble de lo que vimos hace una semana. La positividad de la prueba se ha mantenido esencialmente constante en el rango de 22 a 23%. Si bien estos números cambian a medida que recibamos nuevos informes de casos, hospitalizaciones y defunciones en las próximas semanas, estos números ofrecen un contexto de lo urgente que es poner en marcha medidas adicionales para enfrentar el aumento de nuevas infecciones. Next slide, please. Ayer estábamos viendo 261 casos diarios por cada 100,000 residentes en el condado de Los Ángeles, mientras que los CDC estimaron que el estado vería 134 casos diarios por cada 100,000 residentes. En todo el país hay otros centros urbanos que también registran tasas de casos extraordinariamente altas, con la tasa más alta en la ciudad de Nueva York, con 434 casos nuevos por cada 100,000 residentes. Si bien la disponibilidad de pruebas en cada una de estas jurisdicciones tiene un impacto en estas cifras, todavía indican que nuestra tasa de cambios de casos es relativamente alta y puede aumentar en los próximos días. Next slide, please. Esta diapositiva muestra casos, hospitalizaciones y muertes entre el 1 de julio del año pasado y el 5 de enero. Los casos en verde y las muertes en azul se presentan aquí por la fecha en la que se informaron y las hospitalizaciones en naranja se presentan por la fecha de admisión. Como puede ver, los casos se han disparado un 90% solo en la última semana y los ingresos hospitalarios han aumentado un 121%. Next slide, please. La línea de tendencia en esta diapositiva muestra en naranja el promedio diario del censo de hospitalización por COVID en todo el condado durante el periodo que va desde abril del 2020 hasta 4 de enero de este año, y arriba en rojo el censo hospitalario total en todo el condado durante el mismo intervalo. El fuerte aumento de la línea naranja cerca del final de este gráfico muestra el aumento de las hospitalizaciones durante la última semana de 1,036 a casi 2,000 al 4 de enero. No obstante, a diferencia del aumento repentino del invierno pasado, donde el censo hospitalario general aumentó significativamente, tanto durante el aumento repentino del verano pasado como ahora con el aumento repentino actual, el censo hospitalario general se ha mantenido más estable. Next slide, please. Aunque las hospitalizaciones por COVID han aumentado rápidamente, el porcentaje de pacientes con COVID en las unidades de cuidados intensivos ha aumentado solo ligeramente, del 5 al 7%. En comparación, en el pico de nuestro aumento invernal, más de la mitad de las camas de las unidades de cuidados intensivos en todo el condado estaban ocupadas por personas infectadas con COVID. La trayectoria que estamos viendo en esta línea de tendencias es muy diferente a la que vimos en las pasadas oleadas de verano o de invierno. Next slide, please. Como señalamos a principios de semana, muchos de los pacientes hospitalizados por COVID buscan atención hospitalaria por un problema de salud no relacionado con COVID. Puede que hayan sido hospitalizados para una cirugía de cadera, una operación al corazón o para recibir tratamiento por cáncer. Debido a que el ingreso a todos los pacientes se les hace la prueba de COVID, el aumento en las hospitalizaciones refleja las tasas más altas de propagación comunitaria. Como puede ver en esta diapositiva, a principios de noviembre, antes de Omicron, el 75% de los pacientes hospitalizados que dieron positivo por COVID fueron hospitalizados por problemas médicos relacionados con el diagnóstico de COVID. Sin embargo, una cuarta parte de los pacientes hospitalizados con una prueba positiva fueron diagnosticados con COVID de forma incidental al momento de ser admitidos en el hospital. Pero ahora estimamos que el porcentaje de personas hospitalizadas por la enfermedad de COVID ha disminuido al 45%, lo que significa que más de la mitad de los pacientes hospitalizados con COVID positivo están en el hospital por enfermedades no relacionadas con COVID y probablemente serían hospitalizados independiente de su estado positivo. Si bien es muy alentador ver a menos personas hospitalizadas por la enfermedad de COVID durante este aumento en comparación con picos anteriores, los pacientes positivos por COVID representan una carga sustancial para el sistema de atención médica, independiente del motivo de su ingreso en el hospital. Las personas que han dado positivo por COVID requieren tomar precauciones que se basan en la propagación, las cuales requieren muchos recursos, incluidas salas de aislamiento, personal que se turna y equipo de protección personal, todo lo cual agrega una carga particularmente alta cuando muchos de nuestros hospitales tienen poco personal. Next slide, please. Los hallazgos que sugieren una variante de COVID menos grave son consistentes con la creciente proporción de Omicron entre los casos del condado de Los Ángeles vinculados a los resultados de la secuencia. La semana pasada, Omicron comprendió más del 85% de estos casos, mientras que Delta comprendió el resto. Esta disminución dramática en el total de casos de Delta sugiere que Omicron está desplazando a Delta. Next slide, please. Para comprender mejor cómo resisten nuestras vacunas, tanto la variante Delta como Omicron, podemos ver los datos que tenemos sobre las tasas de casos por 3 categorías de estado de vacunación: sin vacunar, completamente vacunado, sin una tercera dosis adicional o de refuerzo, y completamente vacunados con una tercera dosis adicional o de refuerzo. Los casos han seguido aumentando rápidamente entre todos los grupos. Para los no vacunados representados por la línea de puntos, en la semana que terminó el 25 de diciembre, había 991 casos por cada 100,000 personas no vacunadas. Los casos entre personas que están completamente vacunadas pero que aún no han recibido refuerzos, representados por la línea discontinua, son más bajos. Sin embargo, todavía tienen una tendencia que asciende rápidamente y que alcanzó cada semana el 25 de diciembre una tasa de 588 casos nuevos por cada 100,000 personas. Mientras tanto, la tasa de casos entre las personas completamente vacunadas que también recibieron una dosis adicional o de refuerzo es ahora de 254 por 100,000. Aunque la tasa de aumento en todas estas categorías es pronunciada, sigue siendo mucho más baja entre los que están vacunados y aún más baja entre los que reciben refuerzos que entre los que no han sido vacunados en absoluto, un claro recordatorio de que las vacunas aún brindan protección contra la transmisión de COVID. Next slide, please. Para cuantificar mejor este poder protector, monitoreamos las proporciones de tasas que comparan las tasas en personas no vacunadas con las tasas en personas completamente vacunadas. Cuanto mayor sea la proporción de tasas, más protectora será la vacuna. También podemos observar cómo cambian estas proporciones cuando comparamos a las personas no vacunadas con las vacunadas, pero sin el refuerzo, o las vacunadas y con refuerzo. La columna a la izquierda compara a personas no vacunadas con personas completamente vacunadas, pero sin el refuerzo. Entre las semanas que terminaron el 28 de noviembre y el 25 de diciembre, cuando Omicron comenzó a circular más ampliamente, las personas completamente vacunadas pero sin el refuerzo pasaron de tener 3,4 veces menos probabilidades a 1,6 veces menos posibilidades de infectarse que las personas no vacunadas. Mientras tanto, mirando la columna de la derecha, las personas completamente vacunadas y con el refuerzo pasaron a tener 19 veces menos probabilidades de infectarse que las personas no vacunadas, a tener 3,8 posibilidades menos de contagiarse. Si bien la proporción de tasas disminuyó drásticamente en ambos grupos, la protección sigue siendo más alta ahora para las personas vacunadas y más del doble para las personas que recibieron el refuerzo. Next slide, please. Cuando observamos el aumento de las tasas de casos en una línea de tendencia semana a semana, es fácil sentir que estas tasas son solo números. Sin embargo, observar cómo ha cambiado estas tasas dentro de los grupos raciales y étnicos muestra cuán altos han sido los aumentos para todos. El aumento de casos ha sido particularmente alto entre los residentes afroamericanos y asiáticos, que vieron aumentos de 13 y 17 veces más en las tasas de casos entre el periodo de 2 semanas que terminó el 25 de noviembre y el 30 de diciembre. Estos aumentos han oscilado aproximadamente entre 8 y 9 veces en los residentes latinos y blancos. Next slide, please. A medida que pasamos a observar quién está infectado, a ver quién está siendo hospitalizado, somos conscientes de que existen diferencias significativas en las tasas de hospitalización entre personas según el estado de vacunación. Con hospitalizaciones adicionales esta semana, podemos comenzar a analizar esta métrica utilizando las mismas 3 categorías que usamos para analizar las tasas de casos. No vacunados, completamente vacunados sin una tercera dosis adicional o de refuerzo, y completamente vacunados con una tercera dosis adicional o de refuerzo. Tenga en cuenta que debido a que esta tercera categoría de individuos con refuerzo contiene solo el valor de una semana de datos y muy pocas personas están en esta categoría, esta línea continua es apenas visible como un punto naranja sobre el extremo del eje X del gráfico, y lo hemos rodeado en rojo para una mayor visibilidad. Por encima de esta línea corta, la línea discontinua que representa la tasa de hospitalización en personas totalmente vacunadas, pero sin refuerzo, también sigue siendo bastante baja. Y si bien está aumentando levemente la tasa de hospitalización entre los vacunados, pero aún no ha recibido el refuerzo, sigue siendo 6 veces menor que las hospitalizaciones por cada 100,000 personas no vacunadas que están hospitalizadas, aquí representadas por la línea de puntos. Next slide, please. Al observar las proporciones de tasas de hospitalización a lo largo del tiempo y recordando nuevamente que cuanto mayor sea la proporción de tasas, más protectora será la vacuna, vemos en la columna de la izquierda que en comparación con las personas no vacunadas, las personas totalmente vacunadas pero sin refuerzo pasaron a tener 13 veces menos posibilidades a 9 veces menos probabilidades de ser hospitalizadas que las personas vacunadas en el transcurso de diciembre debido a que Omicron circuló más ampliamente. Hasta hace poco, el número de personas hospitalizadas vacunadas y con refuerzo era demasiado pequeño para que pudiéramos calcular un índice de tasas para este grupo. Sin embargo, a medida que aumentaron las hospitalizaciones durante la última semana de diciembre, descubrimos que las personas que estaban vacunadas y con refuerzo tenían 38 veces menos probabilidades de ser hospitalizadas que las que no estaban vacunadas. Esto significa que si bien recibir cualquier vacuna protegió más que no recibir alguna, la protección fue más de 4 veces mayor en el grupo que recibió el refuerzo que en el grupo que no lo recibió. Next slide, please. Estamos agradecidos de que por el momento las tasas de mortalidad se mantengan bajas y estables. Sin embargo, nos preocupa que con los rápidos aumentos que estamos viendo en los casos y las hospitalizaciones, pronto podamos comenzar a ver un aumento en las muertes. Y lamentablemente es mucho más probable que esas muertes se produzcan entre personas no vacunadas que actualmente tienen 25 veces más probabilidades de morir que las que están vacunadas. Next slide, please. Si observamos ahora los índices de tasa de muertes en el transcurso de finales de noviembre a finales de diciembre, vemos que esta métrica hasta ahora no ha disminuido. Tenemos la esperanza de que esta tendencia continúe, ya que las vacunas brindan una protección extraordinaria contra este peor resultado. Sin embargo, debido a que pueden pasar muchas semanas antes de que aumenten las muertes después de un aumento en el contagio, tendremos que observar estos datos durante las próximas semanas. Next slide, please. Continuamos rastreando los resultados entre las personas que han sido vacunadas por completo, independiente de si han recibido dosis adicionales, para ayudarnos a visualizar el impacto relativo de los diferentes resultados en este grupo. Como de costumbre, el aumento de casos, hospitalizaciones y muertes entre las personas con todas las vacunas se visualizan aquí a escala. El recuadro verde grande representa a los más de 6,4 millones de residentes completamente vacunados en el condado de Los Ángeles. Entre la semana pasada y esta semana, la proporción de personas totalmente vacunadas que dieron positivo por COVID aumentó del 2% representado por el cuadro punteado blanco al 3% de todas las personas vacunadas representada por el cuadro morado. Si bien este gran número de aumento de casos, tenga en cuenta que no hubo un aumento simultáneo en las proporciones de vacunados que fueron hospitalizados o murieron, las cuales se mantuvieron estables en el 0,05% y en el 0,01% de todas las personas vacunadas. Next slide, please. Dado que las vacunas siguen siendo la herramienta más poderosa y ahora están disponibles para todas las personas mayores de 5 años, continuamos rastreando nuestro progreso en la cobertura de vacunación en todo el condado. A partir del 2 de enero, el 79% de los residentes del condado de Los Ángeles mayores de 5 años han recibido al menos una dosis y el 71% está completamente vacunado. El 81% de los adolescentes de 12 a 17 años han recibido al menos una dosis de la vacuna y después de casi 8 semanas de ser aprobados para recibir la vacuna, el 24% de los niños de 5 a 11 años han recibido una dosis de la vacuna. Aunque la cobertura general aumenta ligeramente cada semana, casi 2 millones de residentes aprobados que no han recibido su primera dosis de la vacuna. Nuestros datos sobre los refuerzos también nos dan una lección. Mientras que más de 2,5 millones de residentes del condado de Los Ángeles han recibido dosis adicionales o de refuerzo, hay 2,9 millones de residentes aprobados para recibir el refuerzo que aún no han recibido su dosis adicional. A medida que aumentan los casos y las hospitalizaciones, necesitamos urgentemente que más personas estén protegidas con vacunas y refuerzos. Next slide, please. En este cuadro, las primeras dosis administradas cada semana están representadas en azul, mientras que las segundas dosis están en amarillo y las dosis adicionales o de refuerzo están en naranja. La semana pasada administramos alrededor de 250,000 vacunas, incluidas 43,000 primeras dosis, 35,000 segundas dosis y casi 168,000 dosis adicionales o de refuerzo. Las pequeñas disminuciones que se ven aquí pueden reflejar la temporada de 2 semanas de vacaciones. Con la gente que regresa de las vacaciones y la noticia ayer de que los CDC respaldaron la aprobación de la FDA de los refuerzos de la vacuna Pfizer para niños de 12 años, esperamos ver un aumento aún mayor en la cantidad de personas que se vacunan y reciben refuerzos en las próximas semanas. Next slide, please. Hay 3 prioridades que guían nuestra respuesta durante este pico. Hacer todo lo posible para proteger a las personas médicamente vulnerables, especialmente aquellas que residen en centros de enfermería especializada y se encuentran sin hogar. Asegurarnos de proteger nuestros hospitales y el funcionamiento de nuestros sistemas de atención médica y la reducción de oportunidades para que haya una extensa propagación. Estas prioridades encajan con nuestras estrategias para proteger a los trabajadores y reducir la cantidad de personas infectadas que contagian a otras personas en escuelas y negocios. Con esto en mente, queremos explicar algunos cambios en la orden de nuestro oficial de salud. Next slide, please. Con los casos en aumento, es sensato seguir los hallazgos de la ciencia y hacer todo lo posible para reducir el riesgo y prevenir enfermedades graves y muertes entre nuestros residentes. Una estrategia constante para reducir el contagio es hacer que las personas infectadas se aíslen de los demás y poner en cuarentena a sus contactos cercanos. Nuestra guía para la cuarentena y el aislamiento siguen siendo la misma de la semana pasada. Las personas que dan positivo por COVID-19 deben aislarse, lo que significa quedarse en casa un mínimo de 5 días. El aislamiento puede terminar después del día 5 si hay una prueba negativa el día 5 y no hay síntomas o no hay fiebre y los síntomas se resuelven después del día 5. Sin embargo, si la prueba del día 5 es positiva, si una persona tiene fiebre o si no se puede hacer la prueba, las personas deben continuar aislándose hasta que tengan una prueba negativa o hayan pasado 10 días y no tengan fiebre y los síntomas se resuelvan. Como recordatorio, todos los que dieron positivo deben usar mascarilla de alto grado cuando estén en interiores y exteriores si están cerca de otras personas durante 10 días después de dar positivo. Los contactos cercanos son personas que han estado expuestas a un caso de COVID-19. Aquellos contactos cercanos que estén al día con sus vacunas, totalmente vacunados y aún no aprobados para recibir la dosis de refuerzo o vacunados y con refuerzo y no presenten síntomas, están exentos de la cuarentena. Sin embargo, estas personas deben estar muy pendientes de su salud durante 10 días y si es posible, deben hacerse la prueba de inmediato y nuevamente el día 5. Todas las personas que tengan un contacto cercano deben usar mascarilla de alta calidad durante 10 días, independiente de los síntomas. Y si los hay, vuelve a hacerse la prueba y quedarse en casa. Si alguna prueba es positiva, entonces es hora de seguir las recomendaciones de aislamiento. Aquellos contactos cercanos que tengan síntomas o no estén vacunados o no hayan recibido el refuerzo a pesar de estar aprobados para hacerlo, deben ponerse en cuarentena. Esto significa quedarse en casa por un mínimo de 5 días. Si no tiene síntomas y una prueba realizada el día 5 es negativa, la cuarentena puede terminar después del día 5. Sin embargo, si la prueba del día 5 es positiva, no se puede hacer una prueba, o si tiene síntomas, debe aislarse en casa por otros 5 días. También se requiere usar mascarilla de alto grado en interiores y exteriores cuando esté cerca de otras personas durante 10 días, independiente de si hay síntomas. Como en el pasado, cualquier persona que dé positivo debe notificar a los contactos cercanos que haya tenido en las 48 horas anteriores para que puedan ponerse en cuarentena si corresponde y tomar precauciones. Para aquellos que dan positivo y tienen preguntas, necesitan ayuda para notificar a sus contactos cercanos o necesitan ayuda para aislarse de los demás, pueden comunicarse con nuestro centro de llamadas al 833-540-0473 los 7 días de la semana entre las 8 de la mañana y las 8 de la noche. Next slide, please. En las actualizaciones de esta orden que se publicaron ayer, los empleadores deberán proporcionar a los empleados mejores mascarillas, es decir, mascarillas de grado médico que se ajusten bien, mascarillas quirúrgicas o respiradores N95 o KN95 antes del 17 de enero del 2022. Además, los empleados deberán usar mascarillas en todo momento, cuando estén en interiores en su estación de trabajo o en las instalaciones. Para alinearnos con la orden del oficial de salud del Estado, estamos reduciendo los umbrales de asistencia a los megaeventos a 500 asistentes para eventos en interiores y 5,000 para eventos al aire libre. En los megaeventos, teatros, cines y lugares de entretenimiento, los operadores deberán asumir la responsabilidad de poner avisos y señalización y del cumplimiento de los requisitos de uso de mascarilla. La única excepción a los requisitos de uso de mascarilla en estos eventos es para aquellos espectadores o clientes que están comiendo o viviendo activamente. El oficial de salud también recomienda que siempre que sea posible se consuman alimentos y bebidas solo en las áreas designadas para comer en estos eventos. Los cambios en esta orden también prohíben la comida y bebida en las mesas de juego, en las salas de juego, donde se deben usar mascarillas en todo momento mientras se está adentro, excepto cuando se come o bebe activamente en áreas designadas para comer. Next slide, please. Queremos finalizar señalando los cambios en las recomendaciones sobre el refuerzo. A principios de esta semana, la FDA aprobó los refuerzos de Pfizer para su uso en niños mayores de 12 años y ayer los CDC respaldaron esta ampliación de la aprobación de la población aprobada y recomendaron que los refuerzos se administren 5 meses después de completar la serie primaria de vacunas contra el COVID. Esta diapositiva resume las recomendaciones actuales con respecto al refuerzo. Todas las personas mayores de 12 años que recibieron una vacuna de Pfizer ahora han sido aprobadas para recibir el refuerzo al menos 5 meses después de completar la serie primaria. Los adultos mayores de 18 años que recibieron la vacuna Moderna pueden recibir un refuerzo al menos 6 meses después de completar su serie de vacunación primaria, mientras que aquellos que recibieron la vacuna Johnson & Johnson pueden recibir sus refuerzos al menos 2 meses después de recibir la vacuna Johnson & Johnson. Se prefiere un refuerzo de Pfizer o Moderna, independiente de la serie primaria de vacuna recibida. Aunque los adolescentes de 12 a 17 años solo pueden recibir el refuerzo de Pfizer. Dada la eficacia de los refuerzos para prevenir el contagio y las enfermedades graves, anticipamos que estos cambios aumentarán nuestra capacidad para reducir los peores resultados asociados con el aumento repentino. Sin embargo, con miles de personas recién infectadas cada día, reconocemos lo desafiantes que son estos tiempos. Muchos servicios están sobrecargados y ya que los trabajadores están enfermos o en cuarentena, las familias se enfrentan grandes interrupciones al tratar de cuidar a los infectados o en cuarentena y para muchos es difícil hacerse la prueba y seguir los cambios en las pautas. Requerirá mucho esfuerzo superar estas dificultades y tenemos que hacer todo lo posible para mantenernos a salvo. Quédese en casa si está enfermo. No llame al 911 ni vaya a una sala de emergencias a menos que tenga una verdadera emergencia médica. Cumpla con las reglas de aislamiento y cuarentena para evitar propagar Omicron a otros y reduzca su propio riesgo de contagiar o infectarse al restringir las actividades no esenciales donde haya grandes multitudes. Muchas gracias y hasta la próxima.
Thank you so much, Monica. And thank you to everyone who joined us today. As a reminder, if you have questions for us, you can send them to the media inbox, media@ph.lacounty.gov. We will see you next week.